Part A. Extract 1. Questions 1 to 12. You hear a community nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good afternoon, Mihiraa. I'm Nurse Thames. I understand you've been feeling unwell. Can you tell me a bit about what's been going on?
Oh, it's been dreadful, nurse. Where do I even begin? For the past week or so, I've been plagued by this awful abdominal pain, sharp, stabbing, and it comes in waves. It's as if someone's twisting a knife inside me. Then there's the nausea, it's relentless. I've been vomiting every other hour since this started, and the diarrhea is worse. It's watery and has this very peculiar smell.
That sounds incredibly uncomfortable. I can only imagine how difficult it must be. So, when did you first notice these symptoms starting? Was there anything that seemed to make it worse, or maybe something you ate that could have triggered it?
Well, it all started 3 days after my family's barbecue. We had this lovely spread, seafood, salads, the usual. But now that I think about it, I have eaten some oysters. They tasted fine, but could they have been the culprit? I've been wrecking my brain.
That's interesting, Mihiraa. Oysters, especially raw ones, can sometimes cause foodborne illnesses. So, that might have been the trigger. Have you experienced any other symptoms like fever or chills? Sometimes they go hand in hand with these kinds of infections.
Oh, definitely. I've had chills so bad that I've been shivering under 3 blankets. It's like my body can't decide if it's freezing or burning up. One minute I'm feverish, then the next I'm drenched in sweat. And my energy levels are completely shot, muscle sore, too.
I'm sorry to hear that, it sounds really exhausting. Have you noticed any other unusual symptoms? For example, any changes in the color of your urine or stool, or maybe a rash?
No rash, but my stool has been weirdly pale, almost yellowish. And I keep noticing the salty taste in my mouth, it's driving me crazy. Oh, and my urine's been smelling stronger, like metal. I know, it's a bit weird, right?
Not weird at all, actually. It's good that you're keeping track of all these little details. Changes like that can definitely help us figure out what's going on. How have these symptoms been affecting your daily life? I imagine it must be hard to do much of anything right now.
Oh, it's awful. I usually swim every morning, it's kind of my therapy, you know? But now, even just sitting at my desk feels like a huge effort. I work from home as a graphic designer, so I'm used to being at my desk a lot, but I can hardly concentrate with everything going on. Swimming's completely out of the question at the moment.
That sounds incredibly frustrating. It's tough when something you rely on to feel better actually becomes impossible. Mihiraa, have you tried any treatments or remedies to help with the symptoms? Sometimes home remedies can offer a little relief.
I've tried everything in my pantry. Ginger tea, peppermint oil capsules, probiotics, even charcoal tablets. I've been desperate. I also took some ibuprofen, hoping it would help with the body aches, but now I'm worried it's just making my stomach worse.
I totally understand. It sounds like you've been really proactive. It's possible that some of those remedies, especially ibuprofen, could irritate your stomach further, especially if there's already inflammation. Based on what you've described, I think there's a chance you've contracted something called vibriosis. It's linked to eating raw or undercooked seafood, particularly shellfish like oysters.
That sounds serious. Is it dangerous?
It can be, but if we catch it early and start treatment, it's usually manageable. Vibrio bacteria can cause the gastrointestinal issues you've been describing, like vomiting, diarrhea, and abdominal pain. If it spreads into the bloodstream, it can get more serious, but we'll monitor you closely.
Oh no. Does that mean I'll need to go to the hospital?
Not necessarily, Mihiraa. Right now, we're focusing on rehydration, getting you plenty of fluids and electrolytes. It sounds like you're quite dehydrated, which can explain the fatigue and muscle aches. I'll arrange for oral rehydration salts, and I'll advise you to keep sipping fluids throughout the day. If you don't start feeling better soon, we might consider 4 fluids.
Fluids, okay. Anything else I should do in the meantime?
Yes. It's also important to avoid any seafood until you're fully recovered. Stick to a bland diet, things like plain rice, toast, and bananas, and try to rest as much as possible. I'll coordinate with your GP to get you started on antibiotics, which are often the go-to for treating Vibrio infections.
Antibiotics? Oh, I don't know. Those always upset my stomach. Will they make everything worse?
I understand your concern, Mihiraa. While antibiotics can sometimes cause mild gastrointestinal discomfort, in this case, the benefits far outweigh any temporary discomfort. To help balance things out, I can also prescribe a probiotic that will help support your gut while you're on the antibiotics.
Thank you, nurse. I really hope this will resolve quickly.
You're very welcome, Mihiraa.
Extract 2. Questions 13 to 24. You hear a cardiologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good afternoon, Mihiraa. I'm Dr. Paulton Rees, a cardiologist here at the clinic. What brings you in today?
Good afternoon, doctor. Well, I've been experiencing some discomfort in my chest recently. It's not exactly pain, but a kind of tightness that comes and goes. I thought it might just be stress, but it's been happening more frequently, even when I'm at rest.
I see. Could you describe this tightness in more detail? For example, does it feel like a squeezing sensation or more like pressure? And how long does it last each time?
It feels like pressure, almost as if something heavy is sitting on my chest. It lasts for about 5 to 10 minutes, and it can happen twice or 3 times a week. Sometimes I also feel a bit short of breath, especially when climbing stairs or carrying heavy groceries.
That sounds concerning. Have you noticed any other symptoms, Mihiraa, such as dizziness, nausea, or pain radiating to your arm, jaw, or back?
Yes, actually, I felt slightly dizzy a few times, and once I had this dull ache that extended to my left arm. It scared me because it felt unusual.
Thank you for sharing those details. Before we proceed, could you tell me a bit about your occupation and lifestyle? Do you engage in physical activities or have a particularly stressful routine?
I work as a cybersecurity engineer, so my job involves sitting for long hours in front of a computer. The work can be quite demanding, especially when there's a security breach to address. I don't get much time for exercise, but I try to take short walks during the day.
That helps me understand your situation better. Mihiraa, let's talk about your medical history. Have you had any heart-related conditions before? Or does anyone in your family have a history of cardiovascular diseases?
My father was diagnosed with coronary artery disease in his mid-50s, but I haven't had any heart issues myself until now.
Understood. Based on what you've described, I'd like to perform a physical examination and some tests to evaluate your heart's health. Mihiraa, I suspect your symptoms may be related to atherosclerotic plaque buildup in the coronary arteries. This condition can restrict blood flow and may cause the chest tightness you're experiencing.
Oh, I see. Is that serious?
It can be, but the good news is that we've caught it early enough to take preventive steps. First, I'll perform an ECG and a stress test to monitor your heart's electrical activity and how it responds to exertion. We may also do an echocardiogram and a coronary angiography to get a clear view of your arteries.
All right. If it is atherosclerotic plaque, what kind of treatment would I need?
The treatment typically involves a combination of lifestyle modifications, medication, and possibly minimally invasive procedures if necessary. For now, we would likely prescribe medications like statins to lower your cholesterol and antiplatelet drugs, such as aspirin, to reduce the risk of blood clots.
How long would I need to stay on these medications?
In most cases, these medications are long-term, but will review your condition periodically. You'll also need to adopt a heart-healthy diet, reduce stress, and incorporate regular physical activity. Mihiraa, if the tests show significant blockages, we may consider a procedure like angioplasty to restore proper blood flow.
Are there any risks I should be aware of?
Yes, as with any medication, there are potential side effects. For example, statins can sometimes cause muscle pain or liver issues, so we'll monitor your response carefully. If angioplasty is required, there's a small risk of complications like bleeding or artery re-narrowing, but these are relatively rare.
That sounds manageable. Thank you for explaining everything, Dr. Rees.
You're welcome, Mihiraa. Let's proceed with the tests to confirm the diagnosis and ensure we put you on the right path to recovery.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nursing manager called Mihiraa conducting a meeting. Now read the question.
Good morning, team. I'm excited to announce the implementation of a new pre-procedure checklist. This is a critical step towards enhancing patient safety and standardizing our care processes. The checklist covers essential items like patient identification, allergies, consent, equipment readiness, and timeouts. It's designed to be completed collaboratively with the entire care team, ensuring everyone is on the same page. Remember, this checklist is not meant to replace clinical judgment, but rather to supplement it. It's a tool to help us catch potential oversights and reduce errors. I understand there might be an initial adjustment period as we integrate this into our workflow. We'll provide comprehensive training and support to ensure a smooth transition. Our ultimate goal is to create a safer environment for our patients. Please familiarize yourselves with the checklist and provide feedback as we move forward.
Now look at question 26. You hear a doctor called Mihiraa talking to a nurse. Now read the question.
Nurse Paul, I'd like to discuss the possibility of conducting a lecture session for the nursing staff on the latest advancements in diabetes management.
That's a great idea, Dr. Mihiraa. Our staff could benefit from updated information on the latest treatment options and best practices.
Exactly. I can cover topics such as new medications, insulin pump therapy, and patient education strategies. We can also discuss the importance of early detection and prevention of diabetes complications.
That would be very beneficial. How long do you think the lecture will take?
I estimate around 45 minutes to an hour, depending on the level of interest and questions from the staff.
We can schedule it during our monthly staff meeting, Dr. Mihiraa. I'll coordinate with the nursing team and ensure everyone is available.
Thank you. I'm looking forward to sharing my knowledge and expertise with the nursing staff.
Now look at question 27. You hear a nurse called Mihiraa talking to a colleague. Now read the question.
Mihiraa, I need you to keep a close eye on Mrs. Paul in room 302. She's post-op from a hip replacement and is at risk for delirium. We've seen an increase in post-operative delirium cases lately. Ensure she's oriented to time, place, and person. Encourage early mobilization as soon as possible.
Understood, Linda. I'll make sure to reorient her frequently and assist with ambulation. Should I be monitoring her vital signs more closely?
Absolutely. We want to catch any early signs of infection or complications. Also, pay attention to her pain management. Uncontrolled pain can contribute to delirium. Make sure she's comfortable.
Will do. I'll keep an eye on her pain levels and administer pain medication as ordered. Should I involve the physical therapy team earlier than usual?
That's a good point, Mihiraa. Early mobilization is crucial for preventing complications. Let's get them involved tomorrow morning. The goal is to get her out of bed and walk as soon as possible.
Now look at question 28. You hear a GP called Mihiraa talking to a neurologist. Now read the question.
Dr. Paul, I'm referring Mr. George to your neurology clinic for further evaluation. He's been experiencing persistent headaches and cognitive decline.
Thank you for the referral, Dr. Mihiraa. I'll schedule an appointment for Mr. George. Could you provide me with more details about his symptoms?
He's been complaining of headaches that are often accompanied by nausea and vomiting. He's also having difficulty concentrating and remembering things.
Has he experienced any changes in his vision or speech?
No, his vision and speech seem to be unaffected. However, he's been feeling more fatigued and irritable than usual.
We'll need to conduct a thorough neurological examination, including cognitive tests and imaging studies. Dr. Mihiraa, we may also need to rule out any underlying medical conditions that could be contributing to his symptoms.
Thank you. I appreciate your prompt attention to this matter. Please let me know if you need any further information.
Now look at question 29. You hear a head nurse called Mihiraa talking to the nursing staff. Now read the question.
All right, nurses, let's address the new tablet system. I know there's been a learning curve. The primary goal of the system is to streamline patient data access and improve efficiency. You can input vital signs, medication administration, and progress notes directly.
What about patient allergies? How do we ensure they're clearly visible?
Excellent question. The allergy information is displayed prominently in red at the top of the patient profile. Also, there's a function to flag severe allergies for quick reference during medication administration.
I'm worried about battery life. What if the tablet dies during a code blue?
We anticipated that. The tablets have extended battery life and can be quickly swapped. In Code Blue, we prioritize paper charts as a backup, but the tablet data will be synced once the emergency is over.
Will there be training for everyone? I'm still struggling with the medication module.
Absolutely. We're rolling out mandatory training sessions next week. There will also be online tutorials and a dedicated help desk. Remember, this system is a tool to enhance patient care, not a hindrance. Let's focus on adapting and utilizing its full potential.
Now look at question 30. You hear a nurse called Mihiraa talking to a physiotherapist. Now read the question.
Mihiraa, I'm concerned about Mr. Paul's progress. His physiotherapy sessions aren't showing the expected improvement in his knee mobility.
That's interesting. Has there been any increase in pain or swelling?
Not really. The pain is manageable, but there seems to be a plateau in his range of motion. I've tried different techniques, but nothing seems to be making a significant difference.
We might need to consider other factors. Has there been any change in his medication or overall health condition?
He's been on the same medication for a while now. His blood pressure is slightly elevated, but that's been managed.
Let's schedule a follow-up appointment to assess him thoroughly. We might need to order some additional tests to rule out any underlying issues. It's possible there's an underlying condition affecting his knee recovery.
That makes sense, Mihiraa. I'll schedule the appointment. In the meantime, I'll focus on strengthening the muscles around his knee and providing pain relief.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between Dr. Mihiraa and an interviewer.
Dr. Mihiraa, thank you for joining us today. Let's start with understanding the significance of postoperative care. How critical is it in ensuring patient recovery?
Thank you for having me. Postoperative care is not merely an extension of surgery, it is integral to its success. While surgical precision plays a pivotal role in immediate outcomes, it's the follow-through during recovery that determines whether those results are sustained. Take infection control, for instance. It's not just about administering antibiotics, but involves monitoring wound sites, managing patient comorbidities, and educating the patient on recognizing subtle signs of complications. This holistic approach can prevent setbacks and foster quicker, more comprehensive recovery.
How do you, as a surgeon, assess whether post-op care is proceeding as planned, Dr. Mihiraa?
Evaluation of post-op care hinges on dynamic metrics rather than static observations. We rely on a combination of patient-reported symptoms and clinical evaluations. For example, during follow-ups, we scrutinize the wound's appearance, looking for erythema, exudates, or dehiscence. At the same time, systemic indicators like fever patterns, blood work abnormalities such as elevated white blood cell counts, or changes in inflammatory markers like CRP are tracked. What many overlook is the importance of patient compliance. Subtle deviations from prescribed care can be a red flag for potential complications, prompting immediate intervention.
Infections remain a major concern after surgery. Dr. Mihiraa, could you walk us through the symptoms patients should watch for at different stages?
Absolutely. Recognizing infection symptoms early is pivotal. In the primary stage, localized signs such as redness, swelling, and warmth around the incision are common, often accompanied by mild discomfort. Secondary symptoms manifest as the infection begins spreading. This could include drainage from the site, increasing pain, and systemic signs like a mild fever. Tertiary indicators, which are more severe, involve systemic inflammatory responses, tachycardia, high-grade fever, confusion, or even sepsis in extreme cases. The transition from one stage to the next can be rapid, underscoring the need for vigilance and timely reporting of even seemingly minor changes.
When an infection is detected, Dr. Mihiraa, what steps do you take to address it? Could you elaborate on your action plan?
Tackling post-op infections requires a multi-pronged approach. First, we classify the severity. For superficial infections, local wound care and targeted antibiotics might suffice. But for deeper infections or systemic involvement, we may need surgical debridement, microbiological cultures to tailor antibiotic therapy, and intensive monitoring. A critical aspect is interdisciplinary coordination. An infectious disease specialist might be consulted for antibiotic stewardship. Beyond treatment, we also reassess the underlying cause, whether it's poor surgical technique, patient-related factors like diabetes, or post-op care lapses, so we can refine preventive strategies for future cases.
Dr. Mihiraa, have you encountered any specific cases where post-op infections tested your expertise?
One instance stands out. A middle-aged patient underwent a total knee replacement and initially presented well. However, 3 weeks post-op, she developed low-grade fever and subtle joint pain. Despite normal wound appearance, further investigation revealed a deep periprosthetic joint infection. It required surgical intervention to remove the prosthetic, aggressive antibiotic therapy, and later, a reimplantation. The case underscored the importance of looking beyond superficial signs and the need for long-term vigilance, as certain infections, especially in implants, can have an insidious onset but devastating outcomes if not caught in time.
Finally, how do you gauge a patient's progress during recovery, Dr. Mihiraa?
Recovery analysis is a layered process. Clinically, we assess wound healing, absence of infection markers, and functionality. For instance, after orthopedic surgery, joint mobility and pain reduction are key indicators. But subjective recovery, how the patient perceives their return to normalcy, also plays a role. Tools like patient-reported outcome measures, PROMs, help quantify this. Then, there's long-term tracking. Recovery doesn't end at discharge. Periodic assessments ensure that the patient regains strength, maintains quality of life, and avoids long-term complications like chronic pain or mobility limitations.
Now look at Extract 2. Questions 37 to 42. You hear Dr. Kane G's on the study of teeth health at Mihiraa Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Good day to everyone. I am Dr. Kane G's, a practicing dentist with a deep interest in advancing oral health science. Today, I have the privilege of speaking about an extensive research study conducted at Mihiraa Healthcare Institute, or as many know us, Mihiraa Care. This study investigates the nuances of teeth health, aiming to bridge clinical observations with broader healthcare practices. The methodology at Mihiraa Care underscores the integration of innovative technology and traditional research frameworks. We divided the study into 3 key phases: participant selection, observational assessments, and interventional trials. Participants included individuals from varied demographics to ensure diversity, ranging from children with emerging dentition to the elderly with complex oral histories. The observational phase involved state-of-the-art imaging techniques to analyze enamel integrity, gum health, and underlying bone structures. Meanwhile, advanced AI tools process data to identify subtle patterns often overlooked by conventional means. In the final phase, participants received tailored interventions, including nutritional guidance, oral hygiene tools, and minimally invasive dental treatments. Mihiraa Care's multidisciplinary team ensures that every data point contributes to an intricate mosaic of oral health knowledge. It's not just about finding solutions, but understanding the biological, social, and behavioral factors influencing oral health. The implications of the study extend far beyond dental clinics. Our findings highlight an alarming correlation between oral health issues and systemic diseases, such as cardiovascular problems and diabetes. Mihiraa Care has been pivotal in uncovering these connections, emphasizing the mouth as a gateway to the body. Furthermore, the study demonstrates that early interventions in dental health significantly reduce long-term healthcare costs and improve quality of life. By focusing on prevention and education, Mihiraa Care aims to transform how oral health is perceived, not as an isolated concern, but as integral to overall health. The study prioritizes 3 critical areas: enamel preservation, gum disease prevention, and the interplay between oral microbiota and general health. Enamel, the hardest substance in the human body, remains vulnerable to dietary acids and lifestyle factors. Mihiraa Care's research delves into how specific diets, including those rich in probiotics, could bolster enamel regeneration. Equally important is gum health. The study explores periodontal inflammation, identifying biomarkers that predict its progression. Meanwhile, groundbreaking work on oral microbiota reveals its dual role. A harmonious microbiota protects against infections, whereas an imbalance could trigger systemic conditions. Our research isn't just confined to biological markers. It also examines how socioeconomic factors and public policies influence access to dental care, reinforcing Mihiraa Care's commitment to equitable healthcare. We anticipate several transformative outcomes. One of the primary goals is to develop predictive models using the AI-driven insights mentioned earlier. These models can enable clinicians to identify at-risk individuals before significant damage occurs. Moreover, Mihiraa Care aims to refine therapeutic interventions to be more precise and patient-friendly. The study also expects to catalyze changes in public health policies, advocating for preventive dental care programs. By translating our findings into actionable strategies, we hope to elevate oral health education, particularly in underserved communities. The advantages of this research resonate on multiple levels. For patients, Mihiraa Care's efforts promise personalized treatment regimens that are both effective and minimally invasive. For healthcare providers, the study provides a robust framework for integrating dental assessments into general health checkups. Moreover, by reducing the prevalence of advanced oral diseases, the study contributes to substantial cost savings in healthcare. Society benefits as a whole, with healthier individuals contributing more actively to their communities and economies. The real-world applications of the study are vast. For instance, employers could adopt preventive dental care measures within corporate wellness programs, reducing absenteeism due to dental issues. Schools might incorporate dental health curricula based on Mihiraa Care's findings, fostering healthier habits in children. Clinically, the research offers actionable insights for developing less invasive dental materials and treatment protocols. On a broader scale, it paves the way for integrative healthcare models where dentists, general practitioners, and specialists collaborate seamlessly to address interconnected health concerns.
That is the end of your OET listening test. Now check the answers.